Are you sexually active or thinking about becoming active? Keep watching.
Sexually transmitted infections, or STIs, are one of the most uncommon talked about topics when it comes to sex. Today, we're here to talk to you about the most common ones, their misconceptions, and how to prevent them.
The most common STIs you can get are chlamydia, gonorrhea, syphilis, herpes, and HPV, also known as human papillomavirus, which is the most common STI. There's also HIV, which is human immunodeficiency virus, which is a treatable but not curable disease. If left untreated, it can become AIDS, which is also known as acquired immunodeficiency syndrome.
STIs are highly prevalent among young people who account for a significant proportion of new cases globally. Factors such as limited access to sexual health education, lack of contraception use, and risky sexual behaviors contribute to high STI rates in this age group. Chlamydia, gonorrhea, and syphilis are common STIs among young adults. For example, in 2022, the U.S. CDC data indicates that this age group accounts for about 50% of STIs. According to the CDC, those who have sex early in their adolescent years are more at risk for STIs as the ones living in detention facilities, those involved in commercial sex, young males having sex with males, transgenders, and those with disabilities or mental disorders.
When talking about STIs, you've probably heard a lot of misconceptions. For example, one of the most common ones is that only certain people can contract them. This is not true. Anyone who is sexually active, regardless of race, age, gender, or sexuality, can get and spread an STI.
The second myth about STIs are that no symptoms means that you are not infected. This is false. Many STIs can be asymptomatic. This is why it is super important to get tested regularly, especially if you are sexually active.
The third myth is that you cannot get an STI from oral sex, which is not true. STIs such as herpes, gonorrhea, and syphilis can be transmitted through oral sex.
Myth number 4. If you don't have sexual intercourse, you can't get an STI. This is false. Some STIs are transmitted through blood, kissing, or simply just touching the infected area.
The last myth for today is that condoms are 100% effective at preventing STIs. This is not true. Some STIs, such as herpes, can be transmitted through skin-to-skin contact. If there is an infected area that's not covered by the condom, the risk of transmitting it is increased.
Are at higher risk of STI transmission and often experience more severe health outcomes from untreated infections such as pelvic inflammatory disease and infertility. Also, it can be harder to detect at first, which delays treatment. For example, women are more at risk for infections like chlamydia. The CDC states how it's twice as much for women than men in this age group because of routine screening for females, leading to increased detection. Cultural factors play a huge role in this, such as women being in low-income areas, lowering preventative care access, leading to higher rates. However, men have higher rates of syphilis and HIV due to different exposure and less testing. Men who have sex with men have higher rates of STIs. This occurs because of social norms, underdiagnosis, untreated infections, and less recommendations for screening.
There are many ways you can reduce your risk of contracting STIs. The first way is to get tested regularly. It's smart to get tested every 6 months or between each new partner, and some places you can go to get tested is through your primary provider, or you can also go to Planned Parenthood.
Another great way of reducing the risk of an STI is to practice safe sex. Use condoms correctly and consistently during sex. They are very effective at reducing the risk, but remember, not 100%.
Communicate with your partners. Always disclose your STI status. Open and honest communication is key.
The last way to reduce your risk is to get vaccinated. There are many vaccinations available for certain STIs such as HPV. Talk to your provider about your options.
20 young people are believed to contract a STI each year, excluding HIV and other viral infections. According to a WHO report, global HIV and STIs created various health challenges which cause 2.5 million deaths each year. The WHO states that regions such as Africa and the Americas have higher numbers of syphilis, with the Americas having increased cases. The curable types, chlamydia, gonorrhea, and syphilis, are responsible for over 1 million of new cases each day. In 2016, the WHO found that these were part of around 376 million new infections among those in the group worldwide, high in sub-Saharan Africa and parts of Southeast Asia. Lower income regions generally face greater challenges in managing STI rates. Social economic factors, including racial and ethnic disparities, poverty and marginalization, access to health care, substance abuse, stigma, and sexual networks. For example, the 26 million new STIs in 2018 in the United States of America are estimated to have incurred $60 billion in direct medical costs for the American healthcare system.
Be aware of any myths that may be spread about STIs for yours and your partner's safety. But most importantly, remember that STIs are common and nothing to be ashamed of. Stay honest and stay safe.